Covering a lot of ground here on Arise Review this Sunday. The Ebola outbreak in West Africa is far from over, but the situation has improved enough for President Obama to call back the troops he sent to help with the crisis. Now, ironically, this comes as another kind of contagion is spreading in the United States. In recent years, measles were all but eliminated. But this winter, an outbreak began, apparently at Disneyland in California. It has spread to at least 17 states and the nation's capital. Health officials blame parents who refuse to have their children vaccinated. Well, so-called anti-vaxxers are opting out, putting public health at risk. For the same reason, the U.S. has also seen a resurgence in mumps as well as the whooping cough. Dr. Amar Safdar is an infectious disease specialist. Doctor, welcome back to the show. This movement started back in 1998, and I guess I got to ask, like with drones, as we were talking about in our last segment, what good is this? I mean, how can parents just decide to opt out of vaccinating their children?
Well, there are really two main things about this issue. Well, let's just tackle the second issue first, which is how safe are the vaccines? And I think that's where the concern, it has been brought up repeatedly that, am I doing harm to my child?
Well, and point, as you mentioned it, as I was saying, there was some report that came out that they could be the cause of autism. But how true is that?
There were 12 children reported in this Lancet report by a physician in England. By 2010, that has been retracted by the journal. That actually, on the advice of medical board and ethics board, that study had been retracted, just because the data was misrepresented.
Right.
The ethics of conducting this study was not quite par with the scientific standards. And that's the only study that has shown any association between vaccines, especially MMR, which is measles, mumps, rubella, and autism, or childhood autism. I think it's very important to realize that, and there have been multiple studies, really well-designed, well-structured studies that follow ethical guidelines to show there is no association between autism and vaccination.
Okay, so we have these studies out here now. Of course, it certainly means something, right? But then you have a potential presidential contender, Governor Chris Christie, that comes out and says it's a parent's choice. I mean, come on. So it's not a parent's choice, or at least it shouldn't be. And what's being done about this?
Okay, that brings me to the first point that I was going to make, which is, what are we trying to prevent? Is it really a benign disease? Is it common cold versus influenza? Is it a benign childhood disease where a child develops few days of fever and a rash? Or is it measles, which could be life-threatening, or if not life-threatening, and if a child lives through it, there is a higher probability of being deaf, having convulsions. So 1 in 1,000 children with measles may have inflammation of the brain.
Sure.
And they may end up with mental retardation. This is a serious infection.
So then why don't you tell that, I'm not saying you in particular, those who are pro-vaccinations, tell that to the anti-vaxxers, some who are very wealthy and well-known here. Jim Carrey and others are saying, hey, look, we're against this. So how do you combat that?
Well, all you have to do is educate people. It would be very difficult to have, especially in our society, and we shouldn't, in fact, mandate. But I think people should realize the benefit of vaccination, understand safety of such an intervention, and more importantly, realize how serious the infection is that is being prevented. So back in the old days, so in late 1970s, I think it was 1979, when WHO declared world free of smallpox, no one would decline sort of having a smallpox vaccination because it was obviously disfiguring. People went blind because of it. It was a very serious infection, and everyone realized it. It appeared that way, right? Measles, most kids would develop fever and a skin rash and be fine. But it is those who don't do well with measles.
Right. Well, something needs to be changed here, and I hope that something will change legally. I'm sure the laws vary state to state, but we can talk about that again. I'm sure this will not go away. Dr. Safdar, thank you, sir.
My pleasure. Thank you.
Well, the Cricket World Cup is under